Hello all, welcome to Doc Monic. In today's session, I shall be talking on mucolytics. Mucolytic is one of the drug used for productive cough. And under that, we have bromhexine, ambroxol, acetylcysteine, carbocysteine, iodostine, and donase alpha. So let's get started. Coming to mucolytic, we have acetylcysteine, carbocysteine, bromhexine, ambroxol, donase alpha, and mechanism for each differs. Coming to acetylcysteine, it has a free sulfidyl group which directly cleaves the disulfide bonds in the that's present in mucus, so it directly breaks. And coming to carbocysteine, it's not a true mucolytic. As I said, it's not a true mucolytic. It's called a mucoregulator, where it increases sialomucins and decreases fucomucins. Sialomucins is the watery part of the mucus, and fucomucin is the thick, tenacious part of the mucus. So by decreasing the thick, tenacious part and increasing the watery part, so it just regulates the mucus. So hence the name mucoregulator. And coming to bromhexine and ambroxol, ambroxol is a active metabolite of bromhexine. And so active metabolite means this is prodrug. So bromhexine is a prodrug. So both have similar action, where it increases the lysosomal activity and depolymerizes the mucopolysaccharide fibers in mucus. Coming to donase alpha, it degrades extracellular DNA in purulent sputum. So this special mechanism, it's only used in cystic fibrosis, and it's not used for regular productive cough. And coming to the uses of all these drugs, it's mainly used in productive cough. And coming to extra uses apart from productive cough, we have acetylcysteine with paracetamol poisoning and ambroxol for RDS. What's RDS? Respiratory distress syndrome in the neonates. Why it's used in RDS means because it can stimulate surfactant production. So hence it can be used in RDS in mothers like preterm when they are expecting a preterm labor, then we can use. And also has got a mild local anesthetic property which can be used in this property is used in lozenges. So it's sometimes used in lozenges. And coming to adverse effects, the group class adverse effect is nausea, vomiting, GI, that is dyspepsia, and rash. And coming to each individual adverse effect, we have for acetylcysteine, when given by inhalation route, it causes bronchospasm. And with donase alpha, there is voice alteration, pharyngitis, rash, and chest pain. And since I told acetylcysteine causes bronchospasm by inhalation, so while administering, we have to give SABA, that is a short-acting beta agonist like salbutamol. And coming to bromhexine, we have it is contraindicated in POD. Notice PP for bromhexine. POD, it's a prodrug and something to do with depolymerization, like polymerization. And we have for donase alpha, we have separate needle jet nebulizer. Then, as I said, acetylcysteine used in paracetamol poisoning. Like, why is it is used? Means in paracetamol poisoning, there is a metabolite called NAPQI that is generated. This this is the toxic metabolite present in paracetamol poisoning. So we have to decrease this. So how do we decrease this? By restoring glutathione stores. Since our body's glutathione stores is depleted in PCT poisoning, PCM poisoning, we give N-acetylcysteine, which forms cysteine, and cysteine with two more amino acids form glutathione, and that's how it prevents. And one more thing you should know is in PCM poisoning, we are giving it orally, but it is since it is a sulfatyl compound, it will be like a rotten egg odor. So to prevent that rotten egg odor, we dilute with the cola, orange, or other soft drinks. It is served chilled. This is one clinical point you have to know. And there's a mnemonic for how to remember this mucolytics. We have ABCD, very simple mnemonic, and one more is adenosine, which not FDA approved, but still it's available. Mm. Then coming to one of the special properties of ambroxol, it acts as a pharmacological chaperone. So this action, it's been investigated for Parkinson disease and Gaucher disease. What it does is, in these, how it acts means, well, this misfolded GCase, that is glucocerebrosidase. So that it will be made stabilized by ambroxol. Then when it is stabilized, it becomes normal. It's a lysosomal enzyme. So the cellular activity and toxicity will decrease toxicity. And this one, I thought it's interesting, so I put it. So we know NAC for N-acetylcysteine. That's today's topic. So I wanted to show other ACs, VKC, MAC. We have blood alcohol concentration. For MAC, we have three things. I hope you guess. We have minimal wave concentration, Mycobacterium avium complex, membranatic complex, premature atrial contraction, coronary artery calcium, OAC, oral anticoagulant, and ESC. And for those who want to attend quiz, so this is only for those who are interested in quiz. So this Vasaka plant, that is how we got bromexin, and then from bromexin we got ambroxol. So it might be asked in quiz. And this one more puzzle, guess the disease. This hyena in the movie, and we have 65 roses coming down. And in acetylcysteine in psychiatric disorders, I just stumbled upon this fact. So it's used in OCD because it influences uh, glutamate. So I just stumbled upon this. So I thought someone might be interested to read. So in future it might become a big thing. So till then, yeah, it's just a thing to know. Thank you.